Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by our amazing pediatrician bestie, Dr. Anthony Porto. Hello, Anthony.
Hi, Jess. How are you today?
All right. Well, today we are going to talk about the pediatric subspecialty of gastroenterology. The clock is ticking, so let's get to it. Anthony, what is a pediatric gastroenterologist?
So a pediatric gastroenterologist, also known as a pediatric GI doctor, is a medical doctor who has specialized training in the care of infants, children, and teens, so anyone from birth to 21 years of age, who experiences problems with digestion, liver disease, or nutritional issues. And this expertise is crucial because it's about a 40-year-old specialty, and because the issues of children and how we manage them can be really different from those seen in adults.
So just anecdotally, my husband's an ER doc, but he primarily works with adults, and he always says that. He's like, when a kid comes into the ER, it's a totally different ballgame. So what kind of training do pediatric gastroenterologists have?
So like all physicians, they'll go through 4 years of medical school, and then they become pediatricians first. So they'll do a 3-year pediatric residency. And then once they complete their residency, they'll do another 3 years, and this is their fellowship. And that fellowship will give them expertise in gastroenterology, hepatology or liver, and nutrition. Then they'll become board certified after that fellowship is complete.
All right. So what types of treatments do pediatric GI docs provide?
So it's a whole spectrum of diseases. And I think, you can have those who have bleeding from the GI tract, those who have lactose intolerance or food allergies or other intolerances. Gastroesophageal reflux is a big one, as we're seeing some kids when they're born, as well as in children and adolescents where these symptoms can also develop. Inflammatory bowel disease, also known as Crohn's disease or ulcerative colitis. Those with liver disease, chronic belly pain probably represents about 40% of our visits. And that can be due to a variety of causes, including chronic constipation. Sometimes kids may come with us with diarrhea, pancreatic issues, and nutritional and feeding concerns as well. In addition to evaluating for these diseases, we can do endoscopies and colonoscopies as well as other types of procedures to make sure that children grow and that we can deal with any underlying inflammation in the GI tract.
Just again, anecdotally, my son, I just had to take him to a pediatric GI doc, and that's because he was having these chronic diarrhea episodes and having accidents, and it was just unbelievable. We have answers and things are better. So thank you in your amazing profession. So if I want to find a pediatric GI doc, how do I go about doing so?
So basically, I would start with your pediatrician to see where you can have a pediatric gastroenterologist that may be local. You can also go to the North American Society of Pediatric Gastroenterology and Hepatology website, which is our North American Society, where all of us belong to that society, and they can have a list also to help you find one that may be more local or may specialize in the condition that your child has. They can be found in children's hospitals, university medical centers, as well as in private offices or private practices. So we are pretty much across all 50 states.
And why would I choose a pediatric gastroenterologist for my child's care?
I think it's what you said. Children are not little adults, and we always say that as pediatricians. So they have unique medical needs, and we really try to focus specifically to the pediatric patient. So we are skilled in examining and treating children, and we try to put them at ease. Most centers will also have child life specialists. We'll have caring for them in the rooms will look more child friendly. And we really design the entire experience with the child in mind. So we'll have a team of dietitians, psychologists, social workers, whatever your child may need. And so if your child's pediatrician recommends a visit to one of us, please rest assured that they will receive the best possible care that's tailored to their individual needs at their age of development.
All right. Well, I learned something. We hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.